McKenzie Repeated Cervical Retractions. This is a good exercise for a posterior derangement or a central disc prolapse in the cervical spine. This type of problem can cause neck and shoulder pain. If the prolapse is severe, then the pain can also go down your arms. It comes from the McKenzie assessment and treatment philosophy. Undertaking this exercise, you need to have been assessed by a physiotherapist who is McKenzie trained, as doing this exercise for the wrong problem can make things worse. This exercise is all about post-exercise symptom relief, or what is known as centralization, which is when symptoms move away from the periphery and closer to the midline of the neck. If your symptoms increase more peripherally after performing this exercise, then you must immediately cease the exercise and consult your physiotherapist. If you have any blurred or double vision, feeling sick, feeling dizzy, passing out, numbness in your tongue, or any problems with swallowing, then don't perform this exercise. Also, if you have any cauda equina symptoms, which include bladder and bowel incontinence, retention, urgency, and saddle anesthesia, which is numbness in the saddle area, then this exercise isn't right for you, and you need to see your physio or doctor as soon as possible. If you are unsure, then don't perform the exercise until you have seen your physio or a doctor. Looking straight ahead, tuck your chin in by gliding your head backwards. Don't tip your head back or forwards. It should be like you're giving yourself a double chin. Once you can't go any further back, then relax to the start position. Perform 10 repetitions as far as you can on each repetition. It can bring on worse symptoms during, as long as afterwards the symptoms either lessen or centralize. The frequency that you should do depends on whether your symptoms are above the elbow or below the elbow. For above the elbow, you should do 10 repetitions every 2 to 3 hours. For below the elbow, you should do 10 repetitions every hour. Once your symptoms have disappeared for 3 days in a row, then you can wean the frequency down slowly each day until you stop the exercise. Once recovered, you need to reduce the risk of reoccurrence, which you should speak to your physio about.